Hello, it's Dr. Jon Perlman, Beverly Hills plastic surgeon. I thought it might help or be of interest for a few people at least to hear my comments and thoughts about transgender surgery, since there's been so much talk recently about former Bruce Jenner and his transition to become Caitlyn Jenner, male to female transformation. I understand at this point, from what I've read, he's undergone some surgery, cosmetic surgery to his face and to his breast with the placement of breast implants, as far as I understand, but has not really done genital surgery, at least as yet. It's interesting. I was very surprised when I talked to my patients, mostly female, about the issue. They seem to generally accept it quite readily, and yet more of my male friends and acquaintances have kind of looked upon it as more of a publicity stunt and as a method for him to get acknowledgement for his television show. Well, I've had limited experience with transgender issues and patients, but I've had some experience, and I feel pretty strongly about it. For someone to undergo a transition of this sort, so difficult, it's probably so painful in many ways that it's clear to me that for most of these patients, it's really a compulsion. It's a need, a very strong need. Just as Bruce or Caitlyn has said, it arose from his childhood, that really has to be fulfilled. These people don't do it willy-nilly and without a lot of thought and dedication to the idea. So I myself, though even I feel a little uncomfortable about the transition that these patients undergo, you have to accept that it's a need that they have, and you have to endorse it and support them in it. People don't do radical or make radical changes of this sort without a real strong need for it. And as Caitlyn has said, it was something that arose in her childhood. She felt she was being dishonest about whom she was. And I think, as she said, if she was on her deathbed and hadn't come out and made her transition, she would have felt she'd led her life as a lie. So as difficult as it is, I think we all have to accept and support these changes, and certainly I wish her luck. This type of surgery should not be performed until people have lived for several years across gender in terms of dress and lifestyle and identity. But I do think, as I have seen in several patients who have lived as a female, in the cases that I've seen for 10, 15 years, it's clearly something that will help them to feel better about themselves and to solidify their image as a female by undergoing plastic surgery. So my thoughts, I'd love to hear yours. You may agree or disagree, but I think we have to be open-minded and somewhat compassionate in supporting people who have this issue, because it's a powerful one. Thank you. If you have any questions and would like to call my office, it's 310-854-0031, and you're welcome to visit my website, perlmanmd.com. Thank you so much for your time. Have a good day.